It's not possible to prevent the need for resuscitation in all the cases. Obviously, the obstetric care has to be optimized. Booking of pregnancy and following up with the doctor, so they are aware of what problems to anticipate. So you can anticipate problems and appropriate obstetric decision making. The team works together. There is labor monitoring with the CTG, for example, and then they make the decision to do a cesarean section in a timely fashion. This can reduce the risk to the baby, but there are always cases where you cannot anticipate, and a mother, even in a booked pregnancy, they may come suddenly with bleeding or I said about cord prolapse and sentinel events. So you cannot always prevent need for resuscitation. That's why every hospital who delivers mothers should have a resuscitation team within the hospital. It's not enough to have them on call, and the expert should be able to intervene immediately. As for the outcome optimizing, it's similar to what we discussed in the very beginning. The team has to be aware of their situation. They need to be prepared to work together as a team. And one of the important things that NRP recommends, as well as the units, especially those who don't face resuscitation scenarios in a detailed way frequently, should do something called skill drills or scenario-based teaching. So skill drill is where you have a mock code. You just call the code as a drill, and you have the same equipment that's used, the same team who manages the baby, and there is someone who leads it, who gives a scenario. For example, you may give a baby who is born through meconium stained liquor, who is not breathing, and then step by step, when the resuscitator does the steps, the one who is running it will tell them that the baby is responding. So during the NRP itself, we have similar scenarios, and the same can be applied. This helps the team to follow the sequence. This helps you to act systematically. It helps you to identify gaps. Suppose you have to put umbilical venous catheter and you realize that your trolley isn't organized to do it in a quick way, because in the real resuscitation, time is of essence. Or you may be finding it difficult to get the X-ray to come quickly to do. If the baby is not responding, you need to rule out a pneumothorax or something. Then you need to look at those aspects, how you can improve. For example, we can put the UVC kit in a small packet and keep it in the kit so it's ready to take, and you're not searching around in a box to take the things out. So being organized and regular training in a country like UAE, obviously the regulator like the DOH always checks if the doctors and nurses have completed the NRP on a 2-year schedule. But if you are working in a developing country, the hospital itself may not take the onus, and the hospital management, the head of the department, they have the responsibility to make sure the team is adequately trained, and they need to motivate the team to run these skill drills, because it can be considered boring by some people because they know the theory, but it's about the practical application of it, how they work together as a team, and if your thinking is stimulated in the right way to act at the right time. So it's key to know that your team works together, especially where you don't do it frequently in a small unit. It's very important to do it well.
Great.